Hi everyone. So at the moment there's 52 active cases of people with COVID-19 in the Shepparton area at present, and that's over 30 households now. So the number of households where there's active cases is increasing. In the last 24 hours there's been 11 new cases and 8 new households for those cases. 3 are in existing households. So concerning in some regards that we're still seeing new people testing positive, and of course that just reinforces the really important message that as soon as you get symptoms of COVID-19, no matter how mild they are, that you should come forward and get tested straight away. There's really good access to testing, both at the sites that GV Health are operating, the respiratory clinic at Graham Street, Shepparton, and also at the drive-through testing at the Shepparton Showgrounds. There's GP clinics and other areas in Shepparton and more broadly across the state, of course. The best spot to find out that information about where you can get tested is coronavirus.vic.gov.au. Tonight we're running a community forum at 5:30 p.m, which is just going to be a general information session to give people the chance to hear from Dr. Paul Johnson, who people will have met last time a few weeks ago during a recent outbreak. So just to talk about how we're approaching this current outbreak in Shepparton. Also, we'll hear from people from Shepparton Council in regards to relief arrangements, and hopefully some questions and answer sessions will allow plenty of time for around about at least 30 minutes for people to raise those questions, and I'm sure we'll be able to answer their questions during the course of that live stream. It will be live streamed on the GV Health Facebook page, and we'll share that information later today. I believe it's already circulating around at present, but definitely we'll make that information available today. From a testing point of view, we're seeing around about 500 to 700 tests per day, which is good. But of course, we'd like to see more people coming forward for testing, and as I mentioned earlier, not delaying that. At the moment, there's also 8 people admitted at GV Health with COVID-19 as well, and they're a mixture of age groups from younger adults to middle-aged people to older people as well. So happy to take any questions.
Where is most transmission happening at the moment?
Still within households. That's the primary way that the COVID is being spread, less so in terms of venues and other settings such as that, which is a bit different to what we've seen previously. So again, as I've mentioned in the past, is that we don't want people going to visit friends or family members unless it's for one of the reasons that stands in terms of the public health directions. But of course then that's permitted, but you know, if it's just popping around to say good day or catch up with people for a coffee or whatever, we don't encourage that at all from a household point of view, because we know that that's how COVID is spreading at the moment.
How many people are in isolation?
There's, I don't have the exact number of people in isolation, but there's anywhere between 400 to 450 contacts, so it'd be close to that number, but of course, there's a number of people that are doing the right thing, and look, by and large, the majority of people are doing the right thing, and we're really thankful for that. And for those people who have come forward and been tested when they've had symptoms, that's terrific, and we thank them. And also people who have been vaccinated, that's terrific. So we're expecting today an update on the weekly figures. So last week in the Shepparton local government area, we were 86% single dosed and 45% double dose. So hopefully there's some movement in particularly the double dose number in this last week or so. But again, if you haven't booked an appointment to get vaccinated, please do that straight away. There's plenty of access to vaccination right across the state now.
Of today's numbers, do we know how many are linked or yet to be linked?
Beg pardon, how many?
Are yet to be linked or linked so far?
Yeah, so of the 11 new cases, there's 8 new households. So, and three households are linked. In terms of they're all single, so that would be 8 in total. So as I said before, that's a bit of a concern that we're still seeing new transmission occurring in that way.
Thank you.
expecting to see more positive cases come out of the households that already have just one or two people infected, or is that?
Yeah, as we've seen in the past, that generally, unfortunately, once one person does contract COVID, then we do see that spreading in households. We know that the Delta variant is really contagious, particularly in those close household settings. So we have seen some more positive cases today. It's probably likely that we'll have a similar number, I think, in this current 24-hour reporting period to what we've seen in the last 24-hour reporting period. But again, we just really need people to stay at home, do the right thing, and get tested as soon as they get any symptoms.
In more of a younger portion of the population, are in sort of bigger share houses than just the normal kind of family units? Are we expecting a large number of cases to be linked to it, and or is it going to be more of a smaller number of cases that are linked to the ones that are currently there?
It really, so we've got a mixture of people, younger people, and some children still testing positive. Typically, the pattern is, as I said before, it is transmission in a household, but that, of course, households are many different shapes and varieties in terms of family groups, extended family groups, or people in share houses. So it's a combination of all of that. I guess the thing is that COVID doesn't discriminate in terms of who or how it's transmitted in that sense from a household point of view. So we're certainly seeing that reflected in the number of households where we do have active cases, and it's a combination of all types of different household mixes.
Yeah, and no one's been transferred to Melbourne?
Not in recent times, no, not in relation to this outbreak.
Are these numbers growing at the expected rate in terms of household transmission, or?
Well, yes, I guess in terms of, it all depends on how many people live in a household, of course, but so definitely where we see a positive person coming, generally most of the people in the household will then subsequently contract COVID. I'm talking specifically about people who are unvaccinated. That's obviously where the greater rates of transmission are occurring. So yes, I think the numbers could increase in the coming couple of days, but again, the simple defence is to get vaccinated, and we know that people who have even had a single dose have a much lower risk of contracting COVID and then also transmission. But on top of that, people who are vaccinated that may have had a single dose, they're not becoming as unwell as people who are unvaccinated. So the best thing we can all do is to get vaccinated as soon as you can to protect yourself and your loved ones.
So just to confirm, it's of the 11 cases, 8 new households. Are all of those households unlinked, or how many of those households are linked?
So that works still. Yeah, so those 8 new households, there would all be, well, they're still new in terms of whether or not they're linked or not. That's still ongoing. The 3 that we know about, those 3 are linked to existing cases. So it's probably just going to take the contact tracing team a little bit more time in relation to the 8 unlinked at this stage.
And of the people in hospital in Shepparton, how many of them are vaccinated?
I don't have that number offhand, but in general, what we're seeing, our experience in recent times is that the majority of people who are requiring admission in hospital are unvaccinated.